My name is Sierra Drain Kelly. I am the Director of Enabling Services here at Mallory Community Health Center.
My name is Willa Mae Horton. I'm the Community Health Worker here for Mallory Community Health Center.
Okay, my name is Pastor Evelyn Hubbard. I am the Senior Pastor of the Commerce Boulevard Christian Church in Robinsonville, Mississippi.
My name is Ramelda Lewis. I'm a healthcare advocate / coordinator for Delta Health Collaborative.
I'm Bailey McPhail. I work here as a pharmacist at Funderburk's Pharmacy in Hernando, Mississippi.
I had this young man and his blood pressure was high, and when he had a stroke, his first thing said, well, Miss Horton, if I had to listen to you, that's water under the bridge. What we're gonna do is just now try to work to get you where you're able to take care of yourself. I educated him on how to take his blood pressure all over again, how to write those numbers down for himself. I told him, to continue with therapy, go to physical therapy, and try to gain all his strength that he had lost back. He's not back to the way he used to be, but he is able now to take care of himself. I think that's a huge success, but he's doing a whole lot better. And like I say, he thanks me every time I talk to him. He said he was glad that he did, sign up for the Community Health Worker Program.
It is a joy when patients send in letters of representation stating the work that Ms. Horton and our community health workers do here in the organization, highlighting how they were at a pivotal point in their life regarding their health care, and how the extra boost of learning, encouragement, and wisdom regarding what was going on with them on a level of understanding that they can comprehend has allowed them to take control of their health and not just be a body sitting in a room, but an active participant in their overall outcomes when it comes to health.
We take blood pressures and we monitor the patrons with their numbers. And so we are concerned about the ones that have, elevated blood pressures. And so we kind of charted those individuals from the month of November last year. We had 3 individuals that had maintained a very good blood pressure that had settled off, and we rewarded those individuals and I did a reward celebration during the morning worship services and presented them plaques and gifts for doing a great job for keeping their blood pressures at bay. And we constantly, doing that with all of our members.
We had a young lady. We did her blood pressure, which was extremely high, as she was on the verge of stroking out. Thank God we had a physician there with us and referred her to the hospital. They admitted her for a couple days. And when she got out, she contacted me and she thanked me for offering the services within the community. It's so many people in that area that need health care and can't get health care. And we bring it to all areas of the Delta.
So we had a patient that we knew was non-compliant on medication and had been previously hospitalized due to blood pressure issues. So we knew that we wanted to put her in this program. When I asked her, how are you taking that medicine? She said, well, I'm just taking the second pill when my blood pressure is high. She didn't really take her blood pressure on a regular basis. And as we know, blood pressure medication works best if you take it consistently. So we packaged her morning meds and her evening meds so that she could follow if she had taken her meds for the day. Her blood pressure ranged around 160/95, and then after these interventions and after taking her blood pressure had significantly improved to about 125/85. Down the line, her doctor put her on the combination tablet, so that further improved her adherence, and she's been doing good since. We've checked in on her, and that's probably our most successful story.
MDHC has been phenomenal with allocating funds for us to get the resources and the toolkits needed for the patients to know their own vitals. It's one thing to enter the clinic and know what the doctor is saying, but it's on another level when you understand what these numbers mean to you as a person and how, when they're out of control, what needs to take place next?
I have been able to build better patient relationships and really provide clinical services to these patients while learning a lot about social determinants of health.
You never have to worry about being supported because they're always there for you. And I've truly enjoyed being part of it, meeting different people, helping people, and getting health care for the ones that need it. If I could just reach one person to help them, I've succeeded.
The Delta Health Collaborative have just been the backbone of our success stories. I just don't preach that one day we all going to go to heaven, in which we hope we do, but we want to live a very healthy life while we're still here on earth. We don't want our days to be sick days and we can't move, we can't do. No, we want to be healthy, and we pray for healing. We know God can do anything, but sometimes we can help ourselves.